Vice President of Communications at Premier Health. In today's Premier Perspectives, I'm talking to Dr. Munir Khalid-Abasi. Dr. Abasi has been with Premier for many years. In addition to being a practicing urgent care physician, he's also our Medical Director of Occupational Health. Thanks for joining me, Dr. Abasi.
Thank you for having me, Phil.
First things first, what made you want to become a physician?
Well, Phil, it has to do a lot with influence from my mom. When she was a young girl, her oldest brother wanted to be a physician. It was in the 20s, and he got TB and consequently died. However, her oldest sister had a son who actually did become a general surgeon. He and several other Black physicians during the Jim Crow era, 1964, and in Dallas, started the first Black hospital in the Dallas area. It was called Forest Avenue Hospital in Dallas. It came into being because at that time, Black physicians were not allowed to practice in the general hospitals. That hospital grew and flourished during that time. Having had the opportunity to talk with him, it gave me great inspiration and the ability to continue through the odds and become a physician.
Wow, that's such a powerful story. How does that fit into what you do today as Medical Director of Occupational Health at Premier?
Well, in my residency, I trained as an internal medicine specialist and later was on the teaching staff at the emergency department at the charity hospital Earl K. Long. I had an opportunity to see all types of different injuries, which allowed me to later transition to urgent care and also occupational medicine.
In terms of care, is there any difference in your approach for these occupational health patients?
Well, our approach for overall care is to handle any sort of issue that the patient has and return them to their normal life. For the fact of the urgent care occupational medicine sort of approach, our plan is to understand what the type of injury is that the employee is presenting to our clinic with, understanding the mechanism, how it happened, but the bottom line is to be able to return the employee or the worker to their full duty with minimal interruption in their life. And not to refer everything out. I think that is one of the cornerstones that we have. We're able to take ownership of the case and be able to take it from the beginning straight on through to completion. And I think that is the thing that makes occupational medicine different than an urgent care sort of setting.
Okay, perfect. So we talked a little bit in the beginning, and we're going to wrap this up. But I want to go back and revisit the fact that it's Black History Month. We just finished celebrating Dr. Martin Luther King Day. So Dr. Abasi, as an African American physician, how did all that shape your approach to medicine today?
Well, I've been fortunate and privileged to care for underserved and indigent populations, as well as those with the ready means to have access to care. So it's kind of that sort of thing that allows me to be well-rounded and to be able to be versatile with my populations.
Well, it sounds to me like you approach your profession from a position of this is my patient, and regardless of their circumstances, their color, that this is my patient and I'm going to treat them the same.
That's correct.
Yeah. And I know that all doctors have that same feeling, but I imagine it's just that it's more profound in someone that has that cultural background and heritage, someone who is African American, and that's just what I imagine. So, lastly, what does making a difference mean to you?
You know, Webster had talked about that in the dictionary, and it was trying to do something to improve and help someone else. My hope and desire is that with each and every day that I interact with people, patients, anyone, anyone that I care for, my family, my friends, patients, and others in the community, that I can create a change that has a positive impact on those individuals that I've encountered. And that's what I feel deeply inside.